When we look at the diets of traditional hunter-gatherers of different kinds, and we look at the ancestral diets that humans had, the things that we were eating before we had obesity epidemics and skyrocketing rates of diabetes and all of this sort of chronic inflammation that we have today, what did the fat profile of those diets look like compared to ours? What percentage of their calories were omega-6s, for example?
Yeah, that's the really interesting question right there because, and I've looked at this at a number of ancestrally living populations, so hunter-gatherers, subsistence agriculturists, and horticulturists. And no matter what population you're looking at, whether they're extremely high fat, like the Inuit, which were once called Eskimos, or the extremely low fat diets of like the Papua New Guineans of Tukasinta or the Japanese or the Okinawans, which are again are a subset of the Japanese. But no matter what, any of these diets, if they're ancestral, in other words, they don't have any seed oils, they don't have processed foods, they don't have seed oils, all of those diets are under 2% omega-6 linoleic acid.
Less than 2%
And
of calories.
2% of total calories, exactly.
And what are we at today?
And by 2008, we were at 11.8%. So we were at, I might have a graph handy here for that, but I'll show you this real quickly. This is our vegetable oil consumption because this will kind of fall into place. You can see here that for those who are able to see this, at 1865, we had zero vegetable oils in our diet. 1900, this is where we were at about 1 gram of vegetable oils. 1909, we bump up because soybean oil. So first we just had cottonseed oil, and then soybean oil came into the food supply in 1909, and that really bumped up consumption to 9 grams a day. Over here by 1960, as I mentioned, we're at 19 grams a day, and by 2010, we're at 80 grams per person per day. And this is and I'll just mention while we're on this. So in 1900, and we didn't really go through this yet, but that was a time when there was no coronary heart disease, essentially. There was no macular degeneration. There had never been a case of Alzheimer's or dementia that wasn't syphilis related.
Well, I want to dwell on this for just a second because it's almost like alien to think about this given how we live today and our state of health and disease. When you say in 1900 there was like virtually no coronary heart disease, you're saying that adults were basically not having heart attacks and things like this.
They weren't. That's exactly right. Nowhere in the world. There's either 8 or 9 papers, I think it was, in the entire 19th century, 1800 to 1900, on coronary heart disease. There was only 2 of those were on thrombotic coronary heart disease, which is the equivalent of a heart attack. Sir William Osler, the most probably famous physician of all time, one of the founding partners of Johns Hopkins Hospital in Baltimore, reviewed his own personal history in 1897, for example, and he had witnessed about a half a dozen cases of angina. He had never witnessed a heart attack. In 1908, he gave a presentation in London, England, and he had witnessed an additional 208 cases, I think it was, of angina. He'd still never witnessed a heart attack.